Although medicine itself is a scientific enterprise, the way we each interact with health systems is based on non-scientific factors, like our personal histories and our cultural beliefs. So when public health officials fail to take these non-scientific factors into account, they're not as successful as they otherwise could be. And we've all seen this play out during the COVID-19 pandemic. In the United States, when the vaccines were initially rolled out, they disproportionately went to white, upper and middle class people because officials did not think about the fact that a lot of people of color have a justified mistrust of medical systems. But these questions of public health interventions and how to make them reach minority and oppressed populations are not new. And looking at how officials in the past navigated these hurdles can help us to do better in the future. So my research looks at the failures of one specific public health intervention that the British Empire did in rural Ireland around 1900, and at the ways that Irish people attempted to reform that intervention to make it better serve their own communities. So I'm focused on the memoir of Bridget Hederman, who was a district nurse on the Aran Islands from about 1900 to about 1920. And district nursing as an official program started in England in the 1840s as a way to provide in-home health care and training on modern sanitation to the poor. And in England, these nurses, who were called Queen's nurses, were extremely successful. But in rural West Ireland, the Queen's nurses were somewhat less successful. They did still save many lives, but they also met with a lot of resistance from the people they were trying to serve. Why? Well, firstly, because their methods were developed with the urban English poor in mind, and the rural Irish poor had very different needs and a very different culture. And secondly, the rural Irish poor did not trust anything coming out of the British government, which made sense because that government had spent hundreds of years trying to destroy their culture and religion and had just let millions of them die in a preventable famine about 50 years prior. So that brings us back to Hederman. Hederman was a district nurse, but she was not a Queen's nurse. Instead, she was operating independently, and this allowed her to respond to the needs of the community she served, and she understood those needs better than the Queen's nurses because she herself was from a similar rural West Irish community. And eventually, she ended up being one of several Irish-speaking women employed by a British-funded, but importantly Irish-run, poverty amelioration program who taught the poor how to keep their homes clean, how to prevent infection, like the Queen's nurses did, but they did so in the Irish language without the kind of progress-oriented colonialist mindset that the Queen's nurses were preaching. And they were more effective because they were taking culture and history into account in their work. So while the program itself was very short-lived, it's an important example of how public health interventions can be more effective when they listen to and employ people from the communities they're setting out to serve. Thank you.
Theo, nailed it. Questions for Theo?
So great presentation, Theo. Thank you very much. So I have some questions kind of framing it from the world of psychology. And if you were to examine contemporary data, do you think that there would be any benefit into examining some of these segments of lesser performing areas to examine how the people who actually did perform, administer health services, is there any difference between them and other health workers, i.e. like conscientiousness or openness to experience where you're taking into account those differences between your culture and the culture that you're serving? I'm happy to clarify that it makes sense. So.
Well, in the period I'm looking at, like the big tension is kind of between like indigenous health practitioners who are still relying on like very plant-based medicine and who don't necessarily know things about like viruses, and this kind of like new sense that sanitation is important and that there's like, you know, chemicals made in laboratories that help people. And so it's like this tension between practitioners who are aware of this and practitioners who aren't, and Hederman kind of straddles that divide. And so she interacts with the indigenous practitioners more effectively than a lot of the other trained nurses. I don't know if that's quite getting at your question.
Yeah, we can talk more later. Thank you very much.
Question here?
Can you talk a little bit about some of the connections between what you saw in this work and the pandemic? Yeah,
so I thought it was really interesting because a a lot of medical history, especially in Ireland, kind of really glorifies the idea of like wiping out those traditional healing practices. And I think in the United States, especially during COVID, we saw a lot of tension with Native American groups and with inequalities related to that. And like that in particular is not really a problem in Ireland anymore. Ireland's become like very integrated, and there's not necessarily a distinct indigenous culture on the West Coast anymore the way there was in 1900. But I think maybe part of the reason for that is that not much attention was paid to like how to modernize and how to save lives without impacting culture. So I think that kind of public health history has just felt a lot more relevant to everyone else, to everyone in the present because of COVID.